So Andy, would you like to start us off with introducing Chloe?
I would be happy to. Hi everybody, Andy Dwyer. My camera remains broke during this epic time of working at home during the COVID crisis, which means that I don't have access to my large fantastic system at CU, so apologies. But hi, I think I know everyone on the call. Andy Dwyer, University of Colorado, Director of the CCSP program. We're really excited, and as you know, we've had some shifts with the program in terms of personnel. Amy Moraski left the program this spring, and then we had a bit of a time where we had a hiring chill at the university once the pandemic hit, and we have now reposted and are very excited to have Chloe Fields, who is going to be joining our team. So she will be taking on some of the responsibilities that Elsa was working towards in terms of the evaluation work, some of the programming working with me. Elsa will remain on for the program for a small percentage moving ahead. So we're not losing her, but Chloe is going to be our mainstay. And depending on the fiscal updates from CCPD about the duration of the program, if we are getting another 1.5-year extension or a year extension, which would have us working in the field for the end of June 2021 versus the grant ending in this June, we may consider also hiring some additional staff to help support us as well. But for the time being, we're really excited because Elsa and myself will still stay involved, and Chloe will be joining us as well. So we're really excited to have Chloe joining as the evaluation program manager in her role. And I'm going to have Chloe introduce herself, talk a little bit about the background, and then she'll be very much integrated into the work. We expect that probably over the next couple of months, Chloe will be meeting with many of you to introduce herself. We will be doing some check-in calls probably after the first of the year once we know what's happening with CCPD funding. And Chloe's going to be joining those with me as well. So will give us some time to really connect her with the work. But we're really excited to have Chloe on the team and on the staff now with CCSP and with the University of Colorado. So Chloe, I will turn it over to you to introduce. And for any of our clinic or team members joining today, if you haven't already introduced in the chat, your name, organization, and what city or municipality you're joining from would be much appreciated. So Chloe can start to be familiar with all of you who are working in the CCSP program. So Chloe, I would love to have you go ahead and introduce yourself.
Thank you, Andy, for that warm introduction. Like Andy said, my name is Chloe Fields, PhD. I am new team member here, and I'm super excited to be working with everyone. My background is primarily focused on colorectal cancer research, so this kind of aligns perfectly with my research interests and my passions as well. I'm definitely looking forward to interacting with each and every one of you. I have a lot of experience in federally qualified health centers and rural and medically underserved communities. So again, I'm very excited of integrating with you all and working to get screenings and working with those patient navigators as well as the providers. So yeah, thanks Andy for the introduction. And I'm going through the chat and looking forward to physically or I guess virtually meeting you in person.
All right, and I just want to say thanks because I do think Chloe, your background, your personal connection with colorectal cancer, and also knowing that this is an area from the public health side and research side has been a huge part of what you're really, with the area that you champion and work. It was a perfect fit for the work that we've done, as well as your work in public health in general. So again, welcome. We're very excited about the team continuing to grow and looking forward. And again, we'll be having Chloe probably connect in those calls and probably doing some connection one-on-one, and hopefully at some point in the next year we'll be able to actually make visits to see all of you at the clinic sites. So and the one thing I just want to say, because I did share a little bit of that perspective about funding, we did have our meeting with the CCPD team in November for our quarterly call, and at the time there's still discussion about the possibility of having a year extension. They will know more, I think, at the end of January based on the fiscal forecast. So we will be continuing to keep you all updated again, whether the grant will sunset per the three-year funding cycle in June of this upcoming summer, or if we will get that extension, which will give us another basically extension until June of 2022 as opposed to June of 2021. We don't know that if there is an extension that number one, CCSP will be one of the programs that is extended. There might be other areas that they choose to focus. We don't know if it would be at the same grantee funding amount or if the provisions of funding would be different. So there's a lot of unknowns. We do know that the EE tax that did pass will probably bring smoking rates down further, which means that of course the amount of funding for CCPD will also decrease as well. So anytime a new tax is introduced around tobacco revenue, the amount of the money in the pot automatically decreases. And so that will make impact, which is of course a good thing because it will deter more smoking, more youth smoking and young kids starting to smoke. But that is the revenue that does fund this program. So they do automatically see that that will make an impact. That might have, that might actually have some influence on if we have that extension year or not. But we will keep you all posted about number one, the extension, number two, if we would be applying for additional monies through CCPD moving ahead. We have been told that, the program has been one of the longest standing Amendment 35 programs. And so we were not likely to get refunded the same way that we have been. But there might be certain areas that we look at additional funding moving ahead. There's potential legislation moving ahead in this legislative cycle to maybe look at how do we really propel colorectal cancer screening navigation moving ahead, even through some legislative updates. But we are still on hold about whether those bills will move ahead. When we know more about those, we will bring those forward as well and talk about maybe the role of clinic staff as well as clinicians and navigators being involved in sharing your experience and being a part of colorectal cancer prevention. But again, that's still a little to be determined. So a lot of moving parts. Probably by the end of January, beginning of February, there will be some big updates about where we're moving ahead, but a million thanks for all of you in terms of working with us. And one thing is for sure is we will have sustained funding until the end of June this year. So we still have a good 6 months for us to continue to do great work and really thinking about our sustainability plans, even at the individual level. So thanks so much for joining. And again, a huge thanks for Chloe for joining and all of Elsa's fantastic leadership as well. And I have made sure Elsa's not totally leaving us yet, but we do know that Elsa is going to transition. Elsa, do you want to share a little bit about your future prospects as well? And I think then we can jump into our agenda for today.
Sure. So really happy to still have the opportunity to stay on CCSP to an extent and continue to support this work and support each and every one of you. I did receive an opportunity with Fight Colorectal Cancer, which is a national nonprofit focused on colorectal cancer patient education, research, as well as policy work. And so I will be the research engagement manager with Fight Colorectal Cancer. Still living and working through remotely from Colorado though. So still will have lots of opportunity to continue to connect with you all. And I will be staying on the grant for a little proportion through the end of this fiscal year. And so really happy to have Chloe on to help support and really lead out this work going forward. She's going to be a huge asset to the team. So we'll send out all of her contact information as well in the follow-up to this call. But at least for the time being, if you can continue to include me on your questions, just so I can make sure to work with Chloe as she's transitioning onto the team to help support each and every one of you. But really excited to still be able to continue to do this work as I'm expanding my horizons.
All right, awesome. And Elsa, again, has been a magnificent part of the team. And again, so glad that she's not going anywhere fully. So just not in the same role, but congratulations, Elsa. So Elsa, what are we covering today?
So today we've been checking in with all of you periodically about COVID as the situation continues to change based on case rates and different changes in how the outbreaks and the pandemic is continuing to unfold as we're waiting for a vaccine. So as we've all seen in the last couple months, COVID rates have definitely gone up in Colorado to higher than they even were in the spring. So we really wanted to get a sense of how things are going at each of your clinics right now. So we did put together a couple of poll questions just to see how things have changed from when we last did a check-in on the situation with each of your clinics in August and when we also did one in the spring. So I have some poll questions I can bring up, and Andy, if there's any other information you wanted to provide at the onset as I'm bringing those up, please feel free to jump in. Okay, so I'm going to put up these first two poll questions, and please take a moment to answer them. They'll pop up on your screen in just a moment. And then if you have any other context or information that you want to provide, feel free to do so in the chat. To do polls, we of course have to do multiple choice. So definitely want to give people the opportunity to make this more of a dialogue as well. So I've put up the first two poll questions. Take a minute to look at them and answer.
And if you're having a hard time seeing things or need help, just come off mute or put it in the chat.
And the first two poll questions, the first one is, are you currently working in the clinic or virtually or a combination of both? And the second one is, in what format are you and your organization currently meeting with patients? In-person, phone, telehealth, combination of in-person / virtual. We've got about 68% voted, so give it another 30 seconds or so.
And again, if you have any problems with the poll at all, just let us know and Elsa can direct you. I can't direct you on how to do it, but Elsa knows the answers.
It should just pop up right in front and you could click your answer. Got 72. Let's see if we can get one or two more answers. If you haven't answered yet, please try to take a moment. Going once, going twice, going 3 times. Okay. So right now it looks like about half of you are currently working in the clinic. And then another half are doing either a combination of virtual and some days in the clinic. And then about 4 of you said that you're working completely virtually from home. And that your clinic is really dialed down in-person visits with patients. There's, of course, most of you are doing a combination of in-person and virtual, probably depending on the need, and then some of you probably in the navigation role really connecting with patients by phone. So looks like things might have changed a little bit from the summer when we were seeing a decrease in COVID cases in Colorado, but definitely glad that there's still the opportunity to meet the needs of patients in a number of different ways. All right, I will move on to the next poll. So this one is about your current role and the role of navigators at your clinic. So the first one is, has your role / work duties changed substantially in the last 60 days? And the second one is, what is the focus of your / the navigators at your clinic's current work duties? So take a look at the polls, put in your answers. And again, if you have any other context you wanted to provide, feel free to put that in the chat. And if you're having trouble seeing the polls as well. Okay, we'll give this one another like 10 seconds. We got a couple more answers last time, so let's see if we can get a couple more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I'm going to end this one. So even though the majority of you said your role has not changed substantially in the last 60 days, I'd love to hear from the 3 of you that said your role has changed in the last 60 days to understand a little bit about how it has changed. So if you were one of the 3 people who said your role changed in the last 60 days, I'd invite you to either come off mute or explain your answer in the chat. Anyone?
This is Cecilia from Clínica Tepeyac.
Hi, Cecilia.
Well, it has changed probably since COVID started. We were trying to doing the regular work more virtual, but also we have been helping at the clinic, especially at the front door, trying to screen the patients. We're trying to help and being part of this task force that is kind of hard, but it's a new experience, and it's I feel proud that being part of the help in the COVID transition and all that. But it's probably our regular work is more virtual, and this is the part in us helping in during the pandemic. Thank you.
Thanks for sharing that, Cecilia. Yeah, I think what I've heard most commonly is that navigators, those doing navigation work, if they are having to come on for other duties, a lot of the time it's helping with front door, helping triage patients. And so definitely know it takes a lot of adjustment and coming on and adapting to new work protocols to step into this new role. So we really appreciate all the time and effort you all are putting into that. And it's helpful to understand that some clinic systems are still involved in that role currently, even though many have returned to just regular navigation work for medical conditions and preventative screenings. Anyone else have anything to share around that? How your role has changed? All right. In the interest of keeping this call short and giving you all some time back today, I'm going to move on to the 3rd set of questions. So this one is really about, does your clinic offer COVID testing? Yes to your patient population, yes to patients and the public, or no. And then second one being, once a COVID-19 vaccine is made available for mass distribution, will you / the patient navigators at your clinic have a role in helping patients access the vaccine? Give it another 10 seconds or so. All right. So for this one, it looks like the majority of clinics are offering COVID testing. It is split, however, as to whether this is being offered just to your patient population or to patients and the public. So if your clinic is one of the clinics that's offering testing to the public as well as just your patient population, I'd love if you could put that in the chat so we've had a few questions come from outside groups about where COVID testing is available. So if your clinic's one of the ones that's offering it to the public as well, would love if you could put that in the chat. And then it looks like one person said that for sure that your clinic system will involve patient navigators and distribution of the COVID-19 vaccine once available, but many don't know yet at this point. That's fine, we are just curious. Andy, do you want to speak at all to the COVID-19 vaccine at all? In this
Sure. And I just want to say thanks a ton, everybody. We're trying to get the real-time beat on what everyone's doing and how we can help support. And then also giving our funders and others an idea about the breadth and depth of what clinics and navigators are doing. So this is super helpful. I do want to just say that I think right now, of course, related to the vaccine and dissemination and then COVID response, we do want to try to make sure that we connect you all to resources such as the Navigator Training Collaborative, some of our public health initiatives that as opportunities come forward about training in this area and what have you, we can help support that. It's of course no replacement for the guidance and some of the training you'll be getting directly from your clinic sites and your leadership at the clinic level. But I think throughout the course of the pandemic, we've been asked about supporting for contact tracing, resource coordination, contact tracing, resource coordination, and some of that case investigation work. So just as a reminder, we do work with PNTC. We have resources available that if you are interested in those, and I think the vaccine dissemination and implementation will be part of what comes. So we, as many of you know and have seen, I think there's 3 major pharmaceutical and industry partners who have now created viable vaccines. There are starting to be conversations about who will receive from frontline workers to different patient populations and different parts of the sectors of our communities that will receive vaccines, and some order about how that's going to be implemented through public health strategies. So we will try to just help in any way we can to support you all in that work. We did ask CCPD in a period when the pandemic was first at its height back last spring, if we could help you all in direct response to COVID-19 and help with certain things. We couldn't at that time do anything apart from our scope of work for colorectal cancer screening, but we do have resources again to help again with the navigation and the different toolkits and resources about the pent-up demand. So one of the things I want to say, moving away from vaccine and COVID directly, I think also based on our evaluation data, we know that most of our clinic systems are screening again at pretty regular rates. But what I would recommend all of you is, even with the holidays here, knowing that we are kind of in that flu season and we're seeing surge, we know that it's harder sometimes to get patients in. But as much as you can really work with patients, we can use as much as our funding for navigating patients as possible. We just want to ask that if you have any questions, comments, or ideas about how we can support you in the cancer prevention realm, we're all ears. We will be doing more education. I'm going to examine the budget about what resources we can put out, materials and what have you coming up the next couple months. But we do have the health department looking at our budget, asking how much resources we're going to need to finish out the year. So I'd like to use as much as we possibly can. So as much as you can do outreach, navigate your patients, move people through patient education. I just really want to say thank you for the commitment and keep up the good work, pedal to the metal. And if we can help support you at all, that's something that we'd really want to do so that we can show that this money is going to good use and that we can make the case for keeping colorectal cancer screening, navigation, and prevention really supported in the future. So I think those are the big things. Again, we will be circling back after the first of the year with most of you. to talk about where you are, what you need. And then Elsa, in terms of our evaluation reporting and what we do know about numbers, is there anything sort of just kind of things to look out for, or any trends that you're seeing right now that you'd like to report to the group?
Sure. So I do know in August and September, clinics were reporting similar rates of completed colonoscopies to the previous 2 years of the grant. However, I have not yet had an opportunity to look at rates as we go in later into the fall and getting towards winter, when we know that COVID has been getting worse. And so we would encourage you to let us know if you're facing obstacles with getting patients through screening and continuing to keep your rates up. We really would like to provide you with as much of the support and money available, as Andy mentioned. And so we have continued to share some of the COVID-19 resources, including resources talking about restarting and continuing to screen patients for colorectal cancer screening, as well as breast, cervical, lung cancer screenings as well, and some of our local resources as well that we've been sending out in the newsletters. Chloe will be able to continue to work on what resources are out there and make sure we're getting you the latest and greatest resources, both about COVID-19 and working with your patient population, and for cancer screenings as well, so we can continue to use this funding. But if your clinic system is having trouble meeting your screening goals, please reach out to us and we'd be happy to work with you one-on-one to continue to support.
And I do know that we have provided allocations as general targets for groups. I know with some of our larger systems are able to see people well over those allocations. Again, we will just keep reimbursing folks as much as we possibly can. So just if you have a month that's going to be huge, let us know. If you have a month that's going to be well below what your average is, let us know so that we can look at that distribution and make sure that we're doing okay. The other thing I wanted to mention is we had several of you submit barrier reduction requests, and thank you for doing that. If you want to send those to me directly, I can help ferry that through our new accounting team since Lori Workman is left. Happy to help you with that as well. So I think there's 2 or 3 clinic systems who've been sharing those along. So we do have plenty of resources for barrier reduction. If you have patients who are using Ubers, taxis, we can't reimburse them, but we can reimburse you. Bowel preparation, elder care, child care, any sort of barrier reduction that you can really think of right now. Copay as well as deductible type things towards insurances are a bit tricky. But if you have something that comes up that you are reimbursing patients for, that we can reimburse you for, bring it to me. I'm happy to explore all kinds of options. It's really about getting patients to these exams and helping any way that we can. So transportation, interpretation, bowel prep, you name it, I'm happy to help explore, and we'll make sure to get you reimbursed. So send them my way. And again, I'll help you work with Barbara and our Kelly in accounting to make sure that you're reimbursed for those items. So I think that covers all for today. We hope everyone has had a great Thanksgiving and coming into the December holidays. Big thanks, and hope you get some time to rest, relax, everybody stay as healthy as possible. Elsa, any other learning opportunities or pieces before we close today?
I did just want to share that we've sent out in the newsletters a few different opportunities to get involved and share your perspective. There's been a focus group and interview opportunity through a study that Andy is connected with, as well as the National Navigation Roundtable. Next week, I believe it's on Monday, will be having their second round of a virtual online, their annual meeting. And Andy's really been helping lead that out as well, but that's specifically targeted at navigators. So if you have an hour or so to hop onto that, they would love to have you, and I'll send that out one more time again. And we've also appreciated when you let us know of events that you know going on in your community. So if there's any events or opportunities for that you think other clinic systems might be interested in, other navigators, as well as resources for the patient population, everyone would love to see those as well. So please just let us know, and thank you very much. We hope that you have a great rest of your week and stay warm and healthy and safe. Take care, everyone.